President William Ruto on Thursday assented to 4 health bills that will support his universal health coverage plan. Speaking after the signing, the president praised stakeholders in the health sector for fine-tuning the bills before passage at both the Senate and the National Assembly. The 4 bills include the Primary Health Care Bill, Facility Improvement Financing Bill, Digital Health Bill, and the Social Health Insurance Bill. Here are the details. President William Ruto on Thursday signed 4 universal health coverage bills into law. Ruto signed the Social Health Insurance Act, Digital Health Act, Primary Health Care Act, and Facility Improvement Financing Act into law at Nairobi State House after the National Assembly passed the bills on Tuesday without amendments. Speaking at the signing, the head of state stated that going forward, Kenyans will now only have to identify themselves and the doctors can pull out their medical records and be able to assist them. He praised stakeholders in the health sector for fine-tuning the bills before passage at both the Senate and the National Assembly.
In the Senate, gave their colleagues in the National Assembly whatever amendments they thought would improve the quality of these pieces of legislation. Again, that demonstrated patriotism, creativity, innovation in how we discharge our responsibilities as Kenyans, but much more specifically, the creativity of our parliament. Where we are today is not the achievement of a single person. Very many people have made sacrifices, huge contributions. They have gone out of their way to get us to where we are today.
The event was attended by several delegates, including the Deputy President Rigathi Gachagua and Health Cabinet Secretary Susan Nakhumicha. On his part, Deputy President Rigathi Gachagua heaped praises for lawmakers for passing the bills, further noting that they will benefit citizenry.
Tremendous effort towards progressing that. While we began with ensuring that we reform Kenya Medical Supplies Authority, and I can confirm to you, the board that we have, the leadership that we have is now on track.
Opportunity because I'm here to salute the members of the National Assembly and the Senate for the expeditious manner in which they had these bills that you have today assented into law. Your Excellency, we continue to applaud the 2 houses of Parliament for the support they are giving to your administration's legislative agenda.
The Primary Healthcare Law aims to strengthen preventive health services by co-opting the 100,000 community health promoters, while the Digital Health Law aims at promoting telemedicine and digitization of health services, hence doing away with the present written transactions.
With health insurance coverage at a low of only 26% nationally, out-of-pocket costs are decimating families and keeping sick people away from treatment. The new Social Health Insurance Act will now address financial barriers to healthcare and the existing challenges faced by NHIF by establishing the Social Health Authority.
On the other hand, the Facility Improvement Financing Law aims at restricting funds raised by public health facilities, while the Social Health Insurance Law aims at abolishing the National Health Insurance Fund while creating 3 new funds: a Primary Health Care Fund, a Social Health Insurance Fund, and a Chronic Illness and Emergency Fund.
The Facility Improvement Fund Act will counter the decrease in funding for public health facilities which often lack the requisite levels of investment, leading to a lack of autonomy, fragmented services, and poor outcomes. This law will entrench financial and managerial autonomy to enhance decision-making, efficiency, and community involvement in the management of facilities.
Ruto is expected to officially launch the Universal Health Coverage Plan in Kericho tomorrow during the Mashujaa Day celebrations. The new laws aims to transform health coverage in the country in line with Kenya Kwanza's pledges. The government will focus on universal health coverage as the main agenda in the coming Mashujaa Day celebrations. This will be the third time universal health coverage is being launched after previously being launched by the Jubilee government.